everyone. I'm Roderick Vicente, caregiver student of St. Augustine School of Nursing. Today, I will demonstrate to you on how the assessing infant vital signs. When assessing vital signs on an infant, you have to start on the most non-invasive vital signs first when the baby is calm and resting. Therefore, you're gonna check the respiration, heart rate, temperature, weight, length, head size, chest size. Before you assess the infant vital signs, you have to make sure that you gather your supplies. You're gonna need an infant size stethoscope, measuring tape, thermometer, a scale, a watch to count with. Make sure that you will gonna sanitize the equipments before and after use. Don't forget to perform a hand hygiene before beginning. First, we're going to check respiration, and we're going to do that first while the infant is laying nice and calm, so we get an accurate reading. A normal respiratory rate in an infant is about 30 to 60 breaths per minute. So before we even start counting respiration, we want to look at the infant, and we want to make sure that they are not in any respiratory distress. So one way we can tell is we can look at the nose. Infants love to breathe through their nose. So we were checking their nostrils, and we were looking for nasal flaring. And if you see that that's not a good sign, also you want to look at the chest, and you want to look for anything like chest retraction. And what looks like, it literally looks like the skin has just been pulled over the ribs, and you can see the ribs very well, and this infant does not have either of those things. In addition, you want to look the infant's skin color and make sure it's appropriate for their skin tone, and that you don't see any signs and symptoms of cyanosis. To count respirations, what we're going to do is we're going to count for 1 full minute the rise and the fall of the chest. New with an adult, you probably remember that if the rate was regular, we could count for 30 seconds and multiply by 2. Well, this is not the case with infant. You're going to do it for 1 full minute because infants' breathing patterns is irregular. They have what's called periodic breathing, where they'll breathe and then they'll stop for a second. So we're going to count for an full minute, and we're looking at that rise and that fall of the chest, and infants like to breathe abdominally. So you're having trouble, what you could do is to lightly place your hand on the chest and feel the rise and fall, but you want to be careful not to disturb the infant and get them crying. To count the heart rate, you want to make sure that you're using the appropriate size diaphragm and bell. And we have an infant here, so we're using infant size for an infant who is less than a month. A normal heart rate is about to 100 to 190 beats per minute, and this can vary the infant is crying or if they're sleeping. Now, if the infant is over 1 month, that heartbeat goes down a little, the normal ranges, and it's about 90 to 180 beats per minute. So to count the heart rate, what we're going to do is we're going to use the apical pulse. We're not going to use the radial pulse like how we do in adults. So to find the apical pulse, what you want to do is to find the fourth intercostal space. Now on, an adult, remember it was the fifth international space at the mid of clavicular line. But for an infant, it's at fourth intercostal space lateral to the mid clavicular line. So you want to find the clavicule, and then we have the breastbone, and we're going to go down and we're going to feel between those little ribs, and we're going to go to the fourth space. So there's 1, 2, 3, 4, and then we're going to just go ahead lateral to the apical pulse. On our infant, we're going to place stethoscope there. On our infant, we're going to place our stethoscope there, and we're going to listen for 1 full minute. Check the temperature in the infant. We're going to check it via the axillary route. So we're going to place the thermometer tip in the armpit of the infant. The normal temperature of an infant can vary anywhere between 97.5 to 99.3 degrees Fahrenheit. To take the temperature, make sure that you turn the thermometer on. Then you're going to place the tip of the thermometer deep inside the fold of the armpit, and you're going to put the arm down. You're going to wait for the thermometer to beep to tell the reading. And obtain the weight her. All you have to do is to lay the baby on a surface so that you can mark it. Wow. Kanay cut mo na ikan this. Then a weight on an infant, you have to remove infant's clothing and any soiled diaper. A dry diaper can be used. So place the infant on the scale. All you have to do is lay the baby on a surface that you can mark it. You may need someone to help you measure the baby because you're going to measure from the head to heel. So lay the baby back. Put their head midline like this. And then just mark their head. Take his leg and extend it outward like this. You have to work with them a little bit and then mark it. At the heel, and a normal length in an infant is about 18 to 22 inches. And then we're going to lift up the baby. You're going need a measuring tape, and you want that measures now a normal head circumferences in an infant is about 33 to 38 centimeters. And what we want is to place the tape measure around the largest diameter of the head. So to those to do that, we're going to place a little bit above the eyebrows and then at the back of the head. So let's do that gently. Just lift the head up, the measuring tape beyond it, and then pull the measuring tape around a little bit, and let's see what we get. And his head circumferences is about 36 centimeters. To measure the chest and circumference, get your measuring tape again, and you'll be measuring this in centimeters. And you're going to take it, use the nipple line as your guide. So you're going to wrap it around there and then measure it in his about your chest circumference. Get your measuring tape. Again, you'll be measuring this in centimeters, and you're going to take it and use the nipple line as your guide. So you're going to wrap it around there and then measure it, and is about 34 centimeters, and his should be about 1 to 2 centimeters less than what the head circumference was okay.